Welcome aboard wherever you are. Continuing our focus on breast cancer, taking a look today at early detection. And I have a brother and sister in the studio. But let's get rid of those shackles and come back, eh? Another Sunday, tiptoeing into a new month. I'm praising all the women, all the families. If your family has been touched by breast cancer, hey, give praise. Not an easy diagnosis, not an easy journey. And today I have a brother and sister in the studio. Dr. Edmond Kojo Brakohiapa. He's a consultant radiologist, senior lecturer with the University of Ghana Medical School, and the director with Safe Haven Cancer Support Center. Next to him, his sister. Wow. A survivor, founder and director of Safe Haven, both the center and the Cancer Support Society. They join me today as we consider the importance of early detection of breast cancer. Yes, through the month, almost all our platforms have been discussing breast cancer. But we'll look at this determining factor. Early detection. How does it change the picture, the outcome? The statistics show us simply the earlier the better. So if you have any concerns, experiences, testimonies to share, WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Ultimate Health on Joy 99.7 FM. We're talking about early detection of breast cancer. Kojo and Janet, you're most welcome.
Thank you. Thank
Janet,
you
you're looking great.
Thank you.
Kojo is looking great, but I won't tell him. Yesterday I managed to swing by your program at Reed Church. But my colors, I was from another event. Mm-hmm. My colors were not as complimentary to the event, so I stayed in the shadows. But great stuff.
Thank
very,
you.
very inspirational and moving.
Thank you.
Right, so we're talking about early detection. Now, you have your own story.
Yes.
And whichever way I look at it, it's so inspiring. But can can you just briefly share with us? I've told my listeners you're a survivor in many ways, right? But share with us briefly just your story.
Okay, thank you again for having us. I always tell people that I'm a 2-time cancer survivor.
Right.
Although personally, I was diagnosed with breast cancer in 2012. Prior to that, in 2009, in 2007 actually, my husband was diagnosed with stage 4 colon cancer.
Wow.
And he died 2 years after he was diagnosed. So, early detection became a very important...
He was diagnosed in 2009.
No, he was diagnosed in 2007
at stage 4.
At stage 4.
Wow.
And he died in 2009. Science in the West is a bit more advanced than what we have here, so they were able to keep him alive till 2009.
Right.
Give us an opportunity to come to terms with the diagnosis because it happened very suddenly. So, after that, I became more vigilant about my health.
Right.
Because what I found was that there were symptoms and there were signs that he was not well.
Okay.
But because we did not understand the symptoms and the signs, we did not act on it.
Right.
And so unfortunately, it got to an advanced stage, it went to different parts of his major organs. And so, treatment was almost impossible.
Right.
3 years after he died, I was diagnosed with breast cancer.
Wow.
But like I said, at that point, I was very much aware of my body and, being on top of my physical and medical examinations.
Right.
So prior to my being diagnosed, a year before I was diagnosed, I just had these symptoms. My hair was falling out. My weight was yo-yoing, going up and down.
Right.
I had a couple of fainting spells. So, I was on top of it, with my doctors trying to find out what was going on. Every test that I did came back negative for anything serious.
Right.
But another aspect of who I am is that I'm very prayerful because I believe that, what we cannot catch, God will catch it. So I pray a lot. 2011 October, I was lying on my bed doing a self-breast exam, and I noticed there was a lump. So I asked my family doctor to refer me to do a mammogram, which I did, and they said there was nothing. They couldn't see anything serious, but I could feel the lump.
Right.
So I was happy for a little bit, but then I thought, no, there was something off. I still didn't feel like everything was okay. So 3 months after that, my family doctor again suggested that I seek a second opinion, which I did with a surgeon who was really well known in the hospital that he worked at. He examined me and said he doesn't think there's anything wrong. And he even said he's 99% sure that there's nothing wrong. And if you live in the West, that's very, unless someone is really sure, they're not going to give you statistics. Yeah.
Right.
They're not going to give you statistics because they're afraid they're going to get sued. But anyway, he said it. So again, I was happy for a little bit. A week and a half later, he calls me and says, but he did a biopsy. That is what saved me. He did a biopsy. A week and a half later, he called me and said, unfortunately, not only did I have breast cancer, it was really advancing aggressively. It was a stage 2 going on a stage 3.
Wow.
So faith and prayer played a big part to my being here today because science said I was fine. So I believe that it was the prayer and, following up, seeking a second opinion is what saved my life. So I had full treatment. I had a mastectomy. I had chemotherapy, radiation, had an extended sort of treatment for the type of cancer that I had. And here I am.
Wow. Sometimes I prefer this way of looking at it from tragedy to tribute.
Right.
Tragedy to tribute. So you turned this around. You definitely fought back, valiantly. You were unrelenting in your search for treatment and cure. And here you are. Listeners, if you've just joined us, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. You just heard speaking Janet Braco-Hiapa. She resides in Canada. She's the founder, director, the engine, the V8 or V12 engine behind Safe Haven Cancer Support Center and Cancer Support Society. Their tentacles go far and wide, right? But the core of her activities and the center or the society are in Ghana and Canada and beyond, right? If you have any questions, concerns you want to share, WhatsApp is 055 11 997. We're live on Facebook and YouTube. Next to her, she said, science said she was okay, but hey, she didn't feel okay. Next to her, is an ambassador of science, her own brother. Indeed, her father himself is now retired, right? A retired radiologist. And here we have his son, Dr. Edmond Braco-Hiapa. He's a consultant radiologist. So he's also a director of Safe Haven Support Center. Dr. Braco-Hiapa, listening to this, and the call and the focus and the emphasis is on early detection. We tell women to do this, and sometimes they get worried because there are women who followed the dictum, and nevertheless, cancer kind of caught up with them. But in Janet's case, the system, the vigilance, the prayers helped. How important is early detection? Her husband was stage 4. She was a bit earlier, but still trouble zone. But this is an important indicator. How important is early detection for us?
Well, on a scale of 1 to 10, I would say it's the importance of 9. Probably even 10. Let's make it 10.
Right.
10 over 10.
It is a critical factor.
Very critical.
Very
critical.
How early this is picked up.
Yes.
Right.
And how early you seek treatment.
Okay.
So if you pick it up early and then you sit, the cancer will still be growing.
Right.
It is important first to pick it up and then to take action.
Right.
Soon after.
So some may pick it up and then they just don't act.
For various reasons.
We'll get to some of those ones.
Yeah.
Right. So pick it up and then take the responsible steps.
Exactly.
For treatment.
Exactly.
If it is conclusive that it is cancer, it needs treatment.
Exactly.
Right. Okay. So let's look at, in terms of statistics, right? We hear that in our parts of the world, the survival statistics are not good because women report late. Can you give us some statistics that bear this out?
Yeah, you see,
in Ghana,
compared to the West,
right?
Breast cancer, the survival rates, or even what we call the prognosis, is based on what we call the most important thing is the staging of the cancer. So you hear somebody say, I'm stage 1, stage 2, stage 3, stage 4. And it gets worse from stage 1 to stage 4.
Okay.
So the best one is stage 1, or what we call stage 0, where there is no lump at all.
Okay.
It's only the mammogram that can pick stage 0 as at now.
Okay.
Then you have stage 1, where the size of the lump is 2 centimeters or less.
Okay.
Up to 2 centimeters. Above that, it becomes stage 2.
Okay.
So stage 1, without any spread of the lesion, a lump which is less than 2 centimeters and has not spread is stage 1. And the research that has been done recently shows that at least in the developed countries like the US, if you get the disease, you see it at stage 1 or stage 0, and you treat it. By 5 years, if there were 100 people, 100 ladies who had the lump and it was cancerous,
at that stage,
stage 0 or stage 1, and they went for treatment, by the end of 5 years, the 100 people will still be living.
All of them would survive.
100%
and
survival
treatment
in the
would
developed
be
countries.
Successful.
Yes.
Right.
By the end of 5 years.
Okay.
But in Ghana, the rate is between 91 to 95%.
Okay.
So if you had 100 ladies with breast cancer detected at stage 0 or stage 1, we expect that 91 to 95% of those women will still be alive
Okay.
by the end of 5 years.
Okay.
So those are the statistics
That's
that we
the
have
evidence.
now.
Right. So as you progress to stage 2 and so on, the number,
Then
the
it
survival
reduces.
percentage
It
reduces.
reduces. So by stage 2, now you're around 90%.
Okay.
From that 95% in stage 1,
Mm-hmm.
it can drop down to about 90%. And then
Even in Ghana.
even in Ghana,
Right.
Ghana may be a little bit lower.
Okay.
These figures are for the US.
Right.
But then as you come down to stage 3, it drops to about 72%, and is lower in Ghana.
Okay.
And then when you go to stage 4, it drops down drastically to about 25 to 30%.
Wow.
So if you had 100 ladies affected and they came in stage 4
Right.
and were managed at stage 4, you have about 70% of them not surviving
Right.
5 years.
Okay.
Only about 30-25%.
Okay,
Yeah.
great stuff. If you just joined us, 23 minutes past the hour of 2 on Joy 99.7 FM. The program is Ultimate Health, your ultimate guide to healthy living. We're taking a close look at the importance of early detection of breast cancer. My guest in the studio, a brother and sister, you just heard speaking, Dr. Kojo Brakohiampa. He's a consultant radiologist and a senior lecturer with the University of Ghana Medical School. Next to him, his sister, a founder, a survivor, I don't know, everything, right? She's the inspiration, the energy behind Safe Haven Cancer Support Centers and the Support Society as well. If you have any questions, concerns, experiences, share them with us on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. And shortly, I'll activate the phone line so you can share your experiences or ask your questions. Now, Kojo, let me ask you this. Many women who get breast cancer have no family history, and indeed at many of the preliminary stages are asymptomatic. There's nothing. You mentioned the size of a lump. Must there be a lump? Must there be symptoms? And for us Africans, we somatize. If there's nothing wrong with my body, really, this noise about checking and going for mammogram and all these things is not going to happen. What exactly would you say to women who, well, I'm fine, I'm okay? I do a lot of reading, and the reading suggests that there are guidelines for screening and detection, which are different for women who are considered of average risk and those at high risk. Can we speak to those for our listeners to understand? When we say a woman has average risk and high risk, and then this business of, asymptomatic women who are not likely to test or screen.
You see, it's easier to talk about the high risk people.
Okay.
So a high risk is somebody who has a history of having had breast cancer before, or a family history in a close relative,
Okay.
like the mother or the mother's sister.
Right.
So that puts you at a high risk. Moderate risk or low risk. A moderate risk would be somebody who doesn't have those factors, such
Okay.
as a relative having had it,
Right.
or hasn't had cancer before. So your risk is just like everybody else. Low risk would have been, back in the day, somebody who is young,
Okay.
because we have known in the past that as you grow older, your cancer risk increases.
Right.
But now things appear to be changing.
Mm-hmm.
Now we are even seeing ladies as young as 18 years old or 21 years old having breast cancer.
Wow.
It's not as common as people who are older than that.
Mm-hmm.
The commonest age range is between 35 and 45 years.
Okay.
At a point in time, it was the 35-year-olds were the ones who had the most numbers of breast cancers in Ghana.
Right.
And of course, we also know that breast cancer affects non-Caucasians about 10 to 15 times earlier than it affects Caucasians. So whereas probably somebody in the West will have it around 50, 60 years old, you can deduct 15 or 40, 15 or 10 years from that, and it brings you to around 45 years, 40, 45 years
Right.
for Caucasians. Unfortunately, the cancers in non-Caucasians, that's
Right.
blacks, is more aggressive.
More aggressive as well. Right.
So you have fewer cancers, but they are more aggressive.
Okay.
And of course, we don't have as much facilities as they have.
Mm-hmm.
At a point in time, about 10 years ago, we only had about 5 mammograms in the whole of Accra.
Wow.
5 mammograms in the whole of Accra about 10 years ago. So you can imagine the whole of Accra, the ladies want a mammogram, where do they go? But abroad, I guess they have more,
Right.
which means they will detect stage 0
Mm-hmm.
more frequently or much earlier,
Okay.
and then they can treat.
Right.
So it's all these challenges which make it important for us to make that effort to detect it early
Okay.
and get the early treatment, because remember, it's aggressive and we get it earlier.
All right.
And when we catch it earlier, we can aim at our almost 100% survival,
Great.
at least within the 5 years.
Understood. I guess my listeners understand that. But let me ask you, so would you agree with me if I say, well, for our parts of the world, look, we don't even need to bother with average risk, high risk. Everybody be vigilant, check, and keep screening, right? I know in other jurisdictions or other parts of the world, they'll say, well, if you are over this age, do your mammograms, is it twice or thrice a year, and so on and so forth. Do those parameters matter, and are they relevant to us in this part of the world?
They're probably more relevant
Okay.
for the reasons that I've just outlined or enumerated, because we don't even have those facilities.
Okay.
Unfortunately, we don't have those guidelines you are talking about.
Mm-hmm.
So maybe somebody in the UK, because they have outlined this procedure,
Right.
you even get a call
Right.
that your
Oh, you reach
mammogram-
this age,
yes,
da, 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 da,
yes,
da, da.
yes,
we
your
call
mammogram
you.
is due.
You're
So
due.
you come. But we don't have any such screening protocols in Ghana. So everybody,
Really?
like you said, everybody has to be vigilant. Is vigilant on your own. And these awareness campaigns
Right.
are helping us to spread that message.
Okay.
I know a lot of people who will say, let sleeping dogs lie,
Uh-huh.
and so on and so forth. But in this case, that dog, while you think you are letting it lie, it is growing.
Right.
And it will grow from a puppy to something like a wolf
Mm-hmm.
and attack you. So
Wow.
we can't let sleeping dogs lie.
Right.
We shall continue to make the noise
Right.
and encourage our sisters, our wives, and our mothers and our men.
And
the
the
men
few males
also
who are
get
also
it
afflicted, right?
to
Yeah.
also keep checking.
Take this seriously.
Keep checking.
Okay.
Yeah.
Right. You might be thinking you're letting a sleeping dog lie, but it is not sleeping. That's what my guest is, emphasize. It's not sleeping. It needs important action. And that's why you need to be checking. It's about 30 minutes past the hour of 2. Let me just run through. Oye in Afienya says, welcome to my home. Oye, I'm there already. Good afternoon, Nortey. Thanks for the good work you're doing. Last week, I sent a message about me being diagnosed with hiatal hernia with all the symptoms. Yeah, I've got your number, and I was supposed to call you. Thanks for reminding me. I wrote the name down. We'll follow up on that and see how we can help you. Thank you and God bless for the education. Hello, good afternoon, Nortey Dua and Ultimate Health Team. Please, may I know the number of mammograms available in Ghana? Please, what is the level of awareness in the schools, especially the tertiary schools? Please, why do we have rare cases in men than women? Okay, please, I suggest that the powers that be should make October a breast and prostate cancer. It's prostate cancer awareness month for all. Okay, great stuff. I didn't get the name there. It says Mamiesi. Oh no. Okay. Right. This one says, good afternoon, Nortey. Please find out for me. I've milk in one breast. I have milk in one breast. Doctor told me it's called ductile and it's not cancerous and it will go by itself. But it's been there for 3 years and it's still there. Please, what should I do? Thank you. I am Nana. All right. We'll talk about signs and symptoms to look out for. Okay, great stuff. WhatsApp is still 055 997. So, Kojo, somebody talking about milk in the breast, doctor says, hey, it's not a big deal. It'll correct itself. It'll go into some form of remission. Is that a problem?
It shouldn't be a problem. I will take the doctor's advice.
Okay.
Doctor will probably have her do some blood tests just to check the levels of some particular hormones.
Right.
And then she should get the explanation
Okay.
as to what is going on.
Right.
I think I would agree with what the doctor is saying.
Okay.
Yeah.
All right. But stay on point, stay vigilant, and monitor. Janet shared with us, she was told things were cool, all right? Not specifically with regard to milk or lactation, but stay vigilant. And if in doubt, Janet, would you endorse this? Seek another opinion?
I am always one for seeking another opinion because you have to, be at peace with yourself.
Okay.
You have to have that certainty that there's nothing wrong, right? So if you're not sure that you're okay, seek a second opinion.
Okay.
I don't know how easy it is to do that here in Ghana. Even in the West, it can be a little bit challenging. Right? But I always say, go talk to someone else.
Okay. Seek another opinion, and by all means, join a support group. Now, screening essentially is looking at targeting persons who don't have the condition over a period of time, right? And hoping and keeping your fingers crossed that you don't find it, right? But it does enhance the chances that if there's something wrong, it will be detected.
Yeah.
Okay. There are various, let me call them screening modalities, right? Various forms of medical imaging, okay? Many of which are not that common or accessible here. Can we go through some of the things that can be done? I know at a point Janet shared that biopsy saved me, right? People need to understand these different tiers of examination and investigations. Can we quickly go through them? Let me just remind my discerning listeners, my phone lines are active, 0302-216-541. 0302-216-541. You get to talk to my special guest, the Brakuhiapa Duo. Yeah, so the range of screening and investigation assessment techniques and those that are more relevant and accessible here. Could you?
Yeah, so the basic, more common techniques or approaches that we'll use is, first of all, the physical examination.
Okay.
Which can be conducted by the person we're talking about,
All right.
or it can be conducted by a medical person.
Okay.
So that is the best one, because you see, we don't have hospitals everywhere, we don't have the other modalities everywhere.
Right.
But at least once you have fingers, you can examine.
Breast self-examination.
Exactly.
Okay.
Exactly. You, the one concerned, you can examine your breast.
And
every
you know
month.
your breast.
Exactly.
Right.
And the more you examine on a monthly basis, especially when you are younger and we didn't expect anything to happen, you get to know how your breast feels.
Okay.
So the minute something changes in one part of the breast, oh, my breasts, they are lumpy. I always feel these little things like maybe a seed.
Okay.
But this time, that one in this corner, it seems to be a bit bigger.
All right.
It's not really painful, but it's not going away like the others do with my menstrual cycle.
Okay.
This one seems to be persisting.
Right.
And after 3-4 months, it's even bigger. Then the next one, after physical examination, is the imaging.
Just a second. So the physical or the clinical examination caused by a health professional is the same thing, looking out for the same things.
Yeah, but they are more experienced
Right.
with what to look out for,
Okay.
whether the lesion is very mobile or whether it's fixed,
Right.
the how it feels,
Okay.
whether it has a lot of nodules or whether it's smooth, things like that.
Okay.
That's what they are trained to do.
Right.
So when you do it, then you go and see your medical practitioner, whether
Okay.
a doctor or a nurse, and then they will also check to
Right.
confirm or debunk your suspicion.
Okay, so that's when all these things about the changes in the nipple, possible discharge, retracted or whatever nipple, and then the skin of the breast also changing. Sometimes that comes in as well. They are told to look out for those things.
Yeah, but,
am I right?
those are late features.
Late features.
Yeah, those
Okay.
are late features. We're focusing on when you don't have those
Okay, right.
those signs.
Great.
Right? When there's just some little lump somewhere,
Okay, understood.
usually not painful.
Mm-hmm.
And because it's not painful, it won't push you to go and seek medical attention.
Okay,
You probably say just, oh, it's not painful, it will go away.
right.
Let me just wait 3 months.
Okay,
Meanwhile, in the 3 months, the thing is probably growing.
okay.
Yeah. So the next modality, as you asked, is the imaging. So with the imaging, we have mammograms
Mm-hmm.
and we have ultrasound
Okay.
for screening.
Essentially, with imaging, we are looking into the body,
You are actually looking into the tissue to
into
see
the tissue, right?
the lump. Because
Okay.
some lumps are so small,
Mm-hmm.
and in fact, all lumps start small.
Right,
I mean, no lump just appears from nowhere, poof, then it's there.
right.
Every lump probably, and I'm not going to say probably, every lump starts
Right.
as a small cell, which divides into a bigger
Divides and then
cell, more
starts.
cells,
Right.
and then now it forms a
Okay.
lump. But while it's starting, there's going to be a point where you don't feel it
Mm-hmm.
because it's just too small. But we can see it.
Okay.
If it's less than 5 millimeters, you may not feel it,
Mm-hmm.
but we can see it. You can see lesions as small as 3 or even 2 millimeters on an ultrasound or a mammogram.
Okay.
And so, depending on your age and what it looks like, we probably advise you.
Again, give us a sense. I mean, ultrasound, most people have heard it. I guess that's more accessible than the mammogram.
It is more accessible
Mhm.
than the mammogram,
Mm-hmm.
but the mammogram can pick the smallest or the earliest stage,
Okay.
which is what we call, I mean, it looks like some little dots.
Right. Okay.
Some little dots.
Just for emphasis, so that our people know that, well, these are some of our challenges. When I say access, it can be financial, it can be other things. But
Yeah.
generally, you'd have more access, though it's a lesser, should I say, form of imaging as compared to the mammogram for what we're looking for. Oh?
Yes. With regards to breast cancer,
Okay.
the mammogram is slightly superior.
Okay.
I'm choosing my words carefully.
Because you are the radiologist, I'm not.
Carefully. It is slightly superior.
Relatively. Right. Okay.
Not relatively, slightly,
slightly.
superior.
Okay.
Because I am saying that the mammogram can pick a stage 0.
Mm-hmm.
An ultrasound,
Which will be missed by the ultrasound.
yes,
Okay.
so it means by ultrasound.
That's
But
the point
that
you're
one can
making.
pick a stage 0.
Right.
And so if you can pick a stage 0, it's better than stage 1.
Okay.
Uh-huh.
Okay.
And there are fewer mammograms than the ultrasounds.
All right.
Ultrasounds, they are everywhere.
Okay.
Because people do pregnancy
Yeah.
scanning, and they are cheaper.
Okay.
The ultrasound is like a bigger machine. It uses X-rays. You need to have a shield, X-ray shield in the room, so it's more difficult and more expensive to handle.
Mm-hmm.
I remember in one of the questions said, how many are there in the country?
Yeah.
In fact, I have no idea.
Right. Okay.
All I know is that now there are more.
Okay. We're
10
we're
years
we're,
ago.
we're growing, but we're not growing at the pace we need to be growing. But it's should I say, good to know that we're growing. Let me just interject with this. This is from Dede in Maryland. Dede, it's been a while, and you've dogged me. Hola, please ask the Kojo, the radiologist, if he frequently screens for breast cancer, that is scans and mammograms, since his sister Janet was diagnosed with breast cancer. So you're asking if he personally screens, or well, I'll ask him to answer both. So that's the day in Maryland. Let me just read another one before you continue. Good afternoon, Nortey. What causes a boy's breast to be protruding like that of girls? What can you do to stop that? Well, there's a stage, adolescence, where you have that, but there are also, I think, times that that may be abnormal. My guest will comment on that. So, question from Dede, I think to you directly. Do you screen? Check yourself?
Well, as a radiologist and a doctor, it's my duty to. Oh, you mean do I screen myself?
Yes.
Oh, yes, I do.
Okay.
I do. I screen myself.
Mm-hmm.
Sometimes I just want to make sure there's nothing. So I know I'll just check.
All right.
Is there something?
Okay. Right. Quick question on I think boys having protruding breasts.
Well, if it's puberty,
Mm-hmm.
if it's around puberty, then we expect that to, you have a lump and which will disappear
Right.
with time. So you don't want to be touching, especially with the ladies.
Mm.
You don't want to go touching that breast bud
Mm.
and cause it not to develop.
Okay. I'll take that from you. I haven't touched any. There are people with dense breast tissue. I knew this was coming up. This is also from Dede. How can one detect a lump against the dense tissues during monthly exams and go for screening in our part of the world where healthcare is expensive? So dense breast tissue.
So dense breast tissue, if you are doing physical examination, you will be encouraged to do it after your menses when all the swelling and discomfort has subsided.
Okay.
It makes you easier to feel lumps. But if it's in relation to, say, a mammogram, then the dense tissue will appear as a whitish hue,
Okay.
same as your lump. So it makes it difficult
Okay.
when it's very dense
Right.
to detect the lump which is white in the breast tissue which is also white.
Okay.
So it'll be like white everywhere. You can't really look at this thing. And that is where ultrasound becomes important.
Mm.
Because now ultrasound will be able to, more often than not, pick up that lump within the dense tissue.
Okay. Great. Dede does clarify that she meant you, and you've answered that. Okay. Great stuff. 44 minutes past the hour of 2 on Joy 99.7 FM Ultimate Health. We're talking about early detection of breast cancer. My guest in the studio, Dr. Kojo Brakonhiapa, consultant radiologist, and Janet Brakonhiapa. She's a founder and director of Safe Haven Cancer Support Centers and also Cancer Support Society. She herself is a double survivor. She has explained that earlier if you've just joined us. My phone lines are active, 0302-216-541. If you have any questions, these are the times to push those buttons and ask your questions. Janet, looking at, and listening to your brother who is in the field, talking about what is available, what is accessible, what is effective or superior, and so on and so forth, doing what you do now. I know that's not all you do. What are your thoughts?
I think it's very, very important. Screening is extremely important for the reasons that Doc, talked about. The earlier, I call him, what do I call you? Brax, right?
Brax.
Brax, yeah.
Motown Brax.
Yeah. So, it's very important because the earlier you catch it, the better.
Okay.
Right? And fortunately, I live in Canada. I don't live in the US, so screening in Canada is free.
Okay.
Right? It's free. Whatever age, it's free. And like he says, we have mammograms, we have ultrasounds, and then in more serious cases, I also had MRIs quite frequently.
Right.
Because what those two don't catch, what mammograms and ultrasounds don't catch, the MRI will catch it. So, to answer your question, very important from the first one, from the self-screening to the diagnostic imaging methods, they are all very important.
Right.
If you have access to them, do them.
Okay. Right. So if you have access to them and can afford them, you have no excuse. And you're playing with the puppy that can turn into a wolf, like my guest said. Kojo, sometimes it goes the full hog or the full Monty, like she's talking about MRIs and other things. And then there's genetic screening, isn't there?
Mm-hmm.
Can we say a word on that for?
Well, those are more technical.
Right.
So we reserve those ones for after the diagnosis has been made. So you do the screening, like you mentioned rightly. When you don't have any sign of the disease, that's when you do screening. But then now we find something.
Okay.
And we need to confirm.
Right.
So that's what the other tests will come in.
Okay.
Whether it's genetic, whether it's the MRI or any other thing. Once you found a disease, you need to do some confirmatory tests.
Okay.
So even the biopsy
Right.
is a confirmatory test because
Right.
you found a lump.
Mm-hmm.
Is it cancerous or is it non-cancerous? So now we need to take tissue to the lab. That's the biopsy.
Right.
Yeah. So either surgeon goes in and, takes out the tissue and takes the whole tissue to the lab, or you come, say, to the radiology department where we put an injection of local anesthesia over the skin of the lump. Then we'll stick in a small needle, take a little bit of the tissue and send it to the pathologist. Your results comes in about 3 to 5 working days.
Right.
By which time the tumor wouldn't have grown in size significantly, if at all. And then you will know whether, and they'll do all sorts of tests. They'll do the genetics if they can have the ability to do that, or they will look for hormones, whether you have proteins or hormone receptors, which can also influence what treatment you are going to get.
Okay.
Yeah. And so they bring your results, and now it's confirmed or debunked.
Right.
If it's confirmed, then you can start planning for treatment as soon as possible.
Okay. So can you receive a conclusive diagnosis in the absence of some of these higher or more advanced confirmatory procedures? If a doctor hasn't done a biopsy and he tells you you don't have breast cancer, and so on and so forth, can you say something on that? Because we get some of these cases. You haven't done it, but you're telling the person with confidence as a professional that they don't have cancer or it is not cancerous. What do you say to that? Can you have a confirmed, conclusive diagnosis in the absence? I know I'm pinning you, but these are the things that the women experience sometimes.
I would say no.
No.
You cannot have a conclusive diagnosis without sending the tissue in question to the lab. I mean, people have looked at imaging, mammograms and ultrasound, and like Janet said, they look at the thing and it looks so rounded and with a smooth margin, and it's not so big, and they'll say, oh, these features, as per what I'm seeing, means the lesion is most likely benign.
Okay.
And that's why I say
non-cancerous.
Non-cancerous.
Okay.
Because it looks smooth. It looks like a gentle thing. You understand? It doesn't look like a wolf with all the fangs bearing and...
Who should be doing this determination, this interpretation you're doing right now?
You mean from the mammogram or the ultrasound?
Yeah, all these things we're talking about. Are we at the level of a specialist or,
Well, I would say the radiologist.
The radiologist.
And even within the radiologist, in some countries, you have people who are just focused on the breast. But, you see, we are taught that cancers have, like from medical school, we told that a cancer has an irregular margin. Is this size, for example, is 4 centimeters or more. It has irregular margins and it's growing into the tissue. So something we say speculation on the mammogram.
Right.
Sending rays of tissue into the normal surrounding tissue.
Okay.
But in my experience, that happens in cancers that have grown to a certain size.
Okay.
If you remember, I said the cancers don't just pop up. They start from little cells.
Okay.
To start to maybe 2 or 3 cells dividing.
So if you wanted to identify those features, you're probably looking at a later
that is what I'm saying.
Stage. Right. Okay.
So at the early stage, when it's now developing from maybe 2 to 4 cells to 8 to something, it may look just like any other benign lesions. So you have to have a high index.
Right.
For me,
of
those that I have picked up.
Right.
Very, very small.
Okay.
I had a high index of suspicion. I looked at the age. I looked at other things.
All right.
And I said, and based on the experiences of others, let's do a biopsy.
Okay.
If it's not cancerous, we thank God.
Okay.
But if it is, we've caught it very early.
All right.
We can do something about it.
Okay. I'm trying to make sure we are harnessing and learning and leveraging from what Janet shared as well. And many people also share some of these borderline predictions, which sound conclusive and then later on turn out to be something else. Great stuff. Please, may I ask to know, Dagati, you are warned. This question is something I have hit. If it is true that frequent sucking of the breast by a male partner, hey, right? Serious business. The women who we have lost will tell you, and some of the women who are under treatment now will tell you that if that was a protective factor, then maybe many of them would not have been afflicted by breast cancer. It's unfortunate that when we do this October focus, this thing pops up, sucker breast in October. Kojo and Janet, what do you say when you hear things like that? I know, I mean, it adds something to it, and maybe it may optimize retention of the message, but scientifically.
Well, I'm not going to speak to the science of it.
Thank you.
But yeah, I'll leave that to Kojo. But it's a question that people, I think, genuinely want to know. Because people always ask that question. And sometimes not in a lewd way. It's something that they've heard.
Not naughty, but you've heard. And it's being promoted. I'm seeking to kill it in that way.
Yeah, so myths need to be debunked.
All
so,
right.
you know, if it's something that people want to know, I think we should explain it to them.
It's been explained. Kojo?
Yes.
What is it in the male oral cavity or whatever that? I mean, it says by a male. Huh?
Oh man.
Waiting
Anyway.
there, ragum or what?
So it all has to do with the effect of the female hormones on the breast tissues. Incessant or prolonged exposure of hormones like estrogen and progesterone
Right.
on the breast tissues have been linked with an increased cancer risk. So any process that will give you some respite from that activity of the hormones on the breast tissue will reduce your risk. When you are breastfeeding, you produce another hormone called prolactin. So sometimes...
But we're not talking about breastfeeding in this case.
Just a minute.
Okay.
Just a minute. So I'm saying when you are breastfeeding, you have this hormone released, prolactin,
Understood.
which causes milk secretion. And that inhibits the action of the other hormones, which increase the risk of breast cancer.
Yeah.
See what I mean?
Yeah.
So when you have prolactin, which is also being released because the baby is sucking, because you are pregnant.
Yeah.
So there are changes in your body. Now the baby is sucking. It helps to produce and release milk for the baby to suck.
But that part is not in contention. I'm waiting for you to.
But
get
the
to
man,
Uh-huh.
the lady is not pregnant. So
Thank
your
you.
sucking does not release that hormone.
Akwaba. Thank you. Agbena.
You don't have those changes, hormonal, chemical changes.
Agbena.
That
I'm
happen when
sure
you're pregnant.
Dagati in DC was waiting for you to prove him, or at least. But I like the explanation.
So there is no inhibition on the female hormones.
Right.
Because there's no prolactin.
Okay.
So you're just sucking for your own reasons
Uh-huh.
and not for breast cancer.
Right. So the sucker and the saki, you are both under your own motivation, right?
you.
Let's not get it twisted. All right. This one, just quickly, we're running out of time. Probably run out of time. For clarification, when I said our part of the world, I meant Ghana and Africa. Yeah, we understood you, Dede. Thanks so much. Can you explain in layman's language what microcalcification is? Asked by a layperson.
So the microcalcifications are small specks of calcium, less than half a millimeter.
Okay.
And these are deposited in or around the cancer cells
Okay.
within the breast. And we are able to detect them on mammogram. So that's how your stage 0 cancer will present.
Okay.
You won't feel usually you won't feel a lump. You just see these little dots of white, which is the calcium. Because if you have looked at an X-ray before, right, you see that the bones are white, and bones have calcium.
Right.
Yeah, it's a whole lot of physics into why they look white.
Okay.
So calcium appears white.
Okay.
And these calciums is what we call calcifications, which are deposited in the area where the cancer is supposed to be as little dots, specks of white.
Right.
And they are less than 5 millimeters. So we call them micro calcification.
Calcification.
When they are bigger, we call them macro calcification. It's just a term that we use.
Right. Okay. I hope that puts my listeners' question to rest. 3 minutes more. Having understood all these things, right? This is something that is progressive. If it is detected, it will progress. So detection alone is inadequate, right?
Yeah.
Insufficient to address what we're dealing with. If it is breast cancer, okay. So I'm going to ask both of you, what would you say to our listeners with regard to screening, early detection? What is the message you want them to hang on to, the take home for them?
Okay, so you detect it, it's diagnosed, and then treat it.
Okay.
You have to treat it.
Okay.
Because if you know what it is and you're not doing anything about it, the puppy is going to grow into a wolf, and the wolf is going to devour you. So treat it. I hear in Ghana sometimes people don't go for treatment because of cost and all that, and other factors, but it's imperative,
right,
that you go ahead and treat it.
Okay. Right. I'm glad Janet brought in that. We talked about it earlier, but it looks like we've hop, skipped, and jumped. The barriers, the reasons why women present late and don't act on some of these things. Could you?
Okay. Before I talk about the barriers, I would say that how early, most people, when you say diagnose it early, or when you do your physical examination, what do you mean by early? Early means a lump which is less than, we don't even want stage 2 anymore. We want stage 1.
Okay.
Most people in Ghana come at stage 3 and 4. That's what we have been describing as late.
Okay.
We're advised to come at stage 1 to stage 2.
Okay.
Stage 2 is 2 centimeters to about 5 centimeters, right? Now, a 1 peso coin is 3 centimeters. A 1 peso coin is about 3 centimeters. A 10 peso coin is 20.5 millimeters, so 2.5 millimeters.
Okay.
That's a 10 peso coin. So it means you are entering into stage 2. As I sit here, I'm saying that let's aim at stage 1,
right,
which is below 2 centimeters.
Pick it up early, right?
So something which is less than a 10 peso coin, something which is like a seed of an orange.
Okay.
And I think I've sent you a picture.
Yeah.
I put a seed of a tangerine on a ruler.
Right.
And I sent you a picture. And it's about 6 millimeters.
Right.
The big part.
Okay.
So when you feel something like that, that is stage 6 millimeters is stage 1B. You see, even the stage 1,
right.
Even the T1 tumor size.
Right.
I told you stage 1 is a T1 tumor, which is less than 2 centimeters.
So we need to pick this thing up early.
Yes. And I'm telling you that even in the T1, they have T1A, T1B, T1C.
Right.
T1A is less than 5 millimeters. That's half a centimeter. T1B is half a centimeter to 1 centimeter.
Okay.
And then T1C is 1 centimeter to about 2.
Right. So the smaller the better.
And I told you that the seed is 6 millimeters. So it's a T1B. It's still stage 1.
Okay.
The smaller the better.
Okay.
So let's pick it up when it's like even that seed.
Okay.
And then you talked about the factors which prevent people from coming. Okay. So
in about 30 seconds.
There are things like religious beliefs.
Okay.
Some people, instead of accepting that the Lord has brought medical people to help them treat, they just want to pray. They'll go to a prayer camp, they will come late. Some people go and put herbs, they will come late.
Okay.
Some people don't have their money genuinely, so they can't come. Some people don't even know where the hospital is. Some people are ill-informed.
Okay.
Some people believe that you don't cut lamps. Some people believe that if you have a lamp, it's a witch. So it's all about information.
Right, and education.
Right.
Great stuff. You've been listening to Dr. Kojo Brakuhiapa, consultant radiologist, director and founder of the Safe Haven Cancer Support Center, and his sister, Janet Brakuhiapa, survivor, founder, director of both the Support Center and the Support Society. Many thanks to you both for sharing. I hope that you have been informed and transformed. Check it and do something about it if you find something. If you don't find something, keep checking. Stick and stay on Joy 99.7 FM. Coming up is the Joy FM mini family pop quiz, where our young children stand a chance of winning an educative trip to Singapore. stick and stay for that exciting, educative contest with our young contestants hosted by Edem Naite. My name is Nortey by nature, produced by